but it's even more cemented in my mind the importance of us having a physiologic approach to the way we treat it. Typically in dentistry, we treat things mechanically. We do things to people, and often the physiologic response of the patient is not considered. If you do something to a patient, they're going to respond. They can respond positively or negatively, but they're going to respond. That's because we are physiologic human beings. We're not mechanical machines, okay? So if you, the typical way that sleep apnea is treated is that we get take some impressions, put a little gauge in the mouth, and then ask the patient to protrude, just like this. And then they send that off, make the appliance, you get it back, and then that's the end of it. Well, I just think that's so inferior to where we should be in this, and it's very, very important, and I'll just to clarify a little bit on that. People who have sleep apnea are broken. If they were well and healthy and in good nick, they wouldn't have sleep apnea. You know, it's a condition that's developed. So these are not healthy, well people that we're dealing with. So often the structure is associated with it. Often it's anatomy, you know, the craniofacial anatomy, the jaw being protruded, different things go on, closing off that airway is associated with it. So it's very important that we have a look at that structure before we put you in a little appliance. If you had a broken arm, and you go to the doctor and it's broken like this, and the doctor says, "Oh, you've got a broken arm, let me put that in a cast," and you walk out like this, you'd think you was rather silly. Okay, they don't do that. They correct the structure first, then they put you in the cast, and in that proper position, that's where you heal. Well, the same with this. Often the cervical vertebrae, for example, they're often just rotated, okay? And you can, with that 3D X-ray that I talked about, you can actually see the rotation, and you can see the airway shutting off in the same zone where that's rotated. So if you don't deal with those things, if you don't get those muscles in a relaxed position, if you've got a bad bite already and your jaw's sitting out here and you just stick it forward, you're going to really, you're putting the person in the cast like this. And the reality is, when you wear an oral appliance as the treatment for sleep apnea, you're in a cast. We want that to be a nice, neutral and supportive position, not a further compromised position, because they're already compromised. It's not just about providing an airway, which obviously is a huge priority. But what if we could provide that airway and give support to this structure and actually have people feeling better and turning down their sympathetic nervous system, which is their stress mechanism, the one that's fighting the sleep apnea all night? What if we could turn that down as a part of our treatment? Because the complexity of what happens with sleep apnea, all the medical conditions that come from it, the things that happen to your hypertension or your high cholesterol, the diabetes, all of these things that go wrong in sleep apnea, it's due to the upregulation or the firing up of the sympathetic nervous system. So if you're able to turn that down, if you're able to optimise this region before you put the patient in the cast, you're already working towards turning down that sympathetic nervous system. That makes sense to me. Just arbitrarily sticking a jaw out to a particular position, taking an impression and sending it off does not make sense to me. And I'm one of the outside of the box thinkers. I want my patients to have the best that they can have, not the least. And that's why we do it the way we do.